Hello friends. Hello friends, welcome to a new lecture today. In this lecture, I would like to discuss about the um, first I would like to discuss about the pathways which are connecting the third nerve. We have learned about the lesions of the third nerve. Now let us learn about the pathways which are connecting the third nerves and what are those lesions, and also the lesions and their syndromes also in this class. Okay. First let us learn about the pathways which are connecting the third nerve first, and then we will learn about their syndrome. So pathways, if you see, so the normal pathway which I have said in my last class, that starts from the ophthalmic nucleus, oculomotor nucleus, that is from their lower motor neuron starts. But there is even upper motor neuron lesions, that is there is also upper motor neuron pathway, or it is also called as supranuclear pathway, that is above the nucleus, right? So before going into the lesions of these upper motor neuron or supranuclear pathway, first we will have to learn about the pathway, right? So the first pathway here, these pathways are for not just third nerve, fourth nerve, and also fifth nerve, sixth nerve. Sorry, that is all the nerves which are connecting the eye muscles. Okay, so these pathway, these three nerves have two pathways. So what are the two pathways? The first pathway is called as frontomesencephalic pontine pathway. The first pathway is frontomesencephalic pontine pathway, whereas the second pathway is parietal and temporomesencephalic pontine pathway. Okay, so the first pathway is frontomesencephalic pontine pathway. So this pathway is mainly for, what is the use of this pathway? This is for conjugate eye movements. This is for conjugate eye movements. So this pathway, this will start in the frontal gyrus, middle frontal gyrus. So okay, this is the central sulcus, precentral sulcus, postcentral sulcus. Now the frontal lobe is divided into three gyri by two sulci: superior frontal gyrus, middle frontal gyrus, inferior frontal gyrus. So here this starts from here. Okay, what is this area? This is middle frontal gyrus, and this includes the area 8, which is called as Brodmann area 8. Okay, so now the pathway, just let me draw a cross sectional view now. This is the cerebrum, midbrain, okay, then pons, medulla, and spinal cord. Cerebellum will be here. This is cerebellum. Okay, these nerve, these muscle, this pathway, it starts from medial gyrus, that is Brodmann's pathway, and then it goes through the corona radiata, and from there to the internal capsule. Okay, this is internal capsule. It reaches the internal capsule. From the internal capsule, it will come to the cerebellar peduncle. So this is the cerebellar peduncle. So from the cerebellar peduncle, in the pons, it decussates. Okay, it will decussate in the pons, at the level of pons, and then it descends to the synapse in the pontine paramedial reticular formation. There will be pontine paramedial reticular formation, which is seen here. This is pontine paramedian reticular formation. It ends here in the synapse. Okay, so this is the ponto first fronto-mesencephalic, then pontine pathway, where the decussation it occurs in pons, and then this occurs. Okay, this is the pathway. Next, it helps in conjugate eye movements. Next, the other pathway is parieto-temporal mesencephalic pontine pathway. What is the use of this pathway? This pathway is for pursuit eye movements, to pursuit eye movements. So I think you guys know what conjugate eye movements is. Conjugate eye movements is, for example, this is the two eyes. So for looking to this side, this eye should move here, this eye should move here. These movement occurs simultaneously. That is, if you see this is right eye, this is left eye, think that the right eye's medial rectus, okay, it is activated simultaneously when the along with the left eye lateral rectus. Sorry, the right eye lateral rectus should the right eye's lateral rectus should should be activated along with the left eye lateral rectus, medial rectus. So this activation should occur simultaneously. So that is called as conjugate eye movements. Now to pursuit eye movements, we need one more thing, which is called as parietal temporo mesencephalic pontine pathway. So where does the pathway originate from? Just a minute. So this is the brain frontal lobe, this is the parietal lobe. Okay, so this is the precentral gyrus, central sulcus, this is the precentral, postcentral, these are the two gyri of frontal gyri. Now we have temporal lobe. So in the temporal lobe and parietal, so this is the occipital lobe. Okay, now in the posterior parietal lobe and superior temporal sulcus. So think that this is the temporal lobe. So this occurs in the two superior temporal sulcus and also posterior parietal lobe. Okay, those start here, and then the fibers will descend unilaterally to the pons. So this is where the fibers start, and if you see, they will descend like this. Okay, let me just draw again this view, cross sectional view again. So if you see in the cross sectional view, the fibers, as the name indicates, they start from the ponto and temporal regions, parietal and temporal regions here. Okay, and these fibers will descend down unilaterally in the pons. Okay, they'll down unilaterally in the pons, and they will join to the medial longitudinal fasciculus at the level of 6th nerve nucleus. So in the pons at the level of 6th nerve nucleus, they will join with the medial longitudinal fasciculus. So for the bundle, I'll use this. This is medial longitudinal fasciculus, and this is the other medial longitudinal fasciculus. Okay, so this pathway is called as parieto-temporal mesencephalic pathway. Okay, so these are the two upper motor neuron lesions. Now what about the lesion? So these are the two upper motor neuron pathways. What are they? One fronto-mesencephalic pathway, the other pontine pathway, the other is parietal temporal mesencephalic pontine pathway. Okay, now before going into one more thing, this means we'll learn about the medial longitudinal fasciculus. We have named a new structure here, which is this one. This is called as median longitudinal fasciculus. Okay, so let us learn about medial longitudinal fasciculus in a minute. So what is this median longitudinal fasciculus? So if you see, I'm just making a line. Okay, now I'm drawing a little smaller structure than the above. Pons medulla. This is the cerebellum. I'm sorry, cerebellum was not good. This is the cerebellum. This is the second cerebellum. Now What is median longitudinal fasciculus? Median longitudinal fasciculus, it is responsible for the normal activity of eye movements. As you see, there are three, third, fourth and sixth nerve nuclei. All the three nerve nucleus, they should be connected to one another. So this connection is through this median longitudinal nerve fasciculus. As I have said, there is pontine paramedian reticular formation, right here. This will connect here. Now this median longitudinal fasciculus and pontine paramedian reticular formation, these are connected. Now let us see how they are connected. If you see the median longitudinal fasciculus, so if you see, there are oculomotor nerve. Oculomotor nerve is present in midbrain. Okay, even the trochlear nerve is in midbrain. Okay, whereas the fifth nerve is in pons, medulla and spinal cord. Sixth nerve is in the abducens, sixth nerve is in the pons. Okay, so all the three nerves which are there here, they are connected with a fasciculus which is called as median longitudinal fasciculus. So this is called as one median longitudinal fasciculus, two median longitudinal fasciculus. Now, okay, now this median longitudinal fasciculus which is there, this will is connected to paramedian pontine reticular formation. So here there is, as I have said here, there is paramedian pontine reticular formation. This is paramedian pontine reticular formation. So this median longitudinal fasciculus, it gives its connection to both the sides pontine paramedial reticular formation. Even this gives its connection to both the sides pontine paramedian fasciculus. Okay, so if you see, if I just magnify this image, so this will give connections to both the sides pontine paramedian fasciculus. Even this the left side, the other side, I'm just drawing it with other color, even this will give connections to both pontine paramedian reticular formation. And these longitudinal fasciculus, these are connected to the nerves 1 2 3 1 2 3, that is third, fourth and sixth nerves. So this is called as, this is pontine paramedian fasciculus. Sorry, I'll write it with other color, black. This is called as pontine paramedian reticular formation. Okay, this one. And this is called as median longitudinal fasciculus. Okay, so this is about the upper motor neuron of third nerve. Okay, it is of two types: fronto-mesencephalic pontine pathway and parieto-temporal mesencephalic pathway. In pontine mesencephalic pontine pathway, it is connected to this pontine paramedian reticular formation, whereas here it is connected to median longitudinal fasciculus, whereas the second one. Okay, so here the fibers are from the superior, here they are from superior temporal gyrus and posterior parietal lobe. Posterior parietal lobe. Sorry, it is not from gyrus, it is from sulcus. I'm sorry. This is from, not from gyrus, but this is from sulcus. Okay, so this is the most important thing, which is pathways connecting the third nerve. Now let us learn about the lesions of these pathways in our next class. Thank you guys for watching my lecture. Thank you.